Tonight, another U.S. patient walks out of a hospital Ebola-free. This as politicians and the media help create an Ebola panic across the country. Who is America really listening to? Politicians or medical experts? And what can be done to help ease the tension over the deadly disease? And tomorrow marks the 2-year anniversary of Superstorm Sandy. The devastating storm washed ashore, destructing everything in its path. And as people across our region still work to rebuild, we want to know, is the region better prepared for another superstorm? And are we, the taxpayers, willing to dig into our own pockets for stronger infrastructure? Plus, Election Day just 1 week away. We have a look at the close races around our region, and we'll dive into the national front. Are the Democrats in deep trouble? Good evening and welcome to RFL. I'm Richard French. Thanks for joining us. Tonight we begin with the Ebola crisis that is sweeping across the country as it relates to, I should more specifically, sweeping across West Africa, and it is causing panic across the states here. Well, today, Amber Vinson, she, the Texas nurse who contracted Ebola while treating patient Thomas Eric Duncan, she is now virus-free and was released from the hospital. Another nurse, Casey Hickok, who was held for 3 days against her will in a medical tent at the University Hospital in Newark, is now at an undisclosed location in Maine. Hickok treated Ebola patients in West Africa and says she never had symptoms of the virus when she came back to the U.S. She and her attorney, they're fighting New Jersey's quarantine rules. 9 states have now instituted some type of quarantine that exceed federal guidelines, and even the U.S. Army is doing the same. A 2-star general and a dozen other soldiers returning from Liberia, they were placed in isolation for 21 days at their base in Italy, even though they have shown no Ebola symptoms. And today, President Obama said the response to Ebola needs to be sensible and based on science. And for one, Dr. Richard Besser agrees.
Yeah, I understand the fear. It's a deadly infection, but we need our leaders to lead, not follow the pack. We're getting mixed messages. Here in New York, where we had the leaders say this doctor posed no risk, but then they went to every place he'd visited and cleaned it up.
And it's not just New York. New Jersey Governor Chris Christie defending his administration's mandatory quarantine order last Friday. With Governor Cuomo to his side, the two joined forces.
A healthcare professional who returns to this region who had exposure to infected people, or citizens who are returning or coming to the U.S. who had exposure to infected people, will be asked to remain in their homes for a 21-day quarantine period. During those 21 days, healthcare workers would check on them twice a day to monitor their temperature and condition. If they develop symptoms, they will be transferred to a hospital.
A couple days later, Governor Cuomo sat on a panel with Mayor de Blasio, who's there, speaking out about the quarantine procedure once again, this time fighting off criticism Monday, saying that he flip-flopped on the issue.
The policy that we outlined on Friday is the policy that I detailed yesterday. Governor Christie and I on Friday outlined the policy for the New York, New Jersey region. Port Authority runs the airports in New York and New Jersey. It's a bi-state agency. We outlined it on Friday. We detailed it last night, which was just 2 days later, because people wanted the details. People wanted information. The policy I detailed is the same policy that we outlined on Friday. It is a policy that applies to the Port Authority, New York and New Jersey. It is the same policy. Well, the federal government doesn't agree with your policy. The federal government doesn't agree with our policy. What's called the CDC thinks that we're being too cautious. I understand that. And frankly, I accept.
Okay, so he accepts. I want to bring in our table right now Dominic Carter, political journalist and author, and Andrew Whitman, senior political correspondent. Okay, I saw amateur hour for 72 hours on the part of the governor. We'll get to Christie in a second, okay? Governor Cuomo sits there, night one, Dominic, and he's flanked by the health commissioner of the city and the mayor of New York City, and they all say, no panic, everybody. We got this under control. We learned about what they did wrong in Dallas. This is where we are right now. This is not a reason to panic. This is not a pandemic. This is how we're going to treat this. They lauded the doctor for going over to Africa and treating people as, now we get reports they need as many as 5,000 additional healthcare workers to treat the exploding virus as it relates to West Africa right now. Then, 17 hours later, he's riding shotgun with Governor Christie, and they're like, forget what we said last night. This is what we're going to do. Quarantine everybody for 21 days when they come in. Apparently behind the scenes, forget the mayor, you got the CDC, you got the administration, you got the health commissioner from New York City saying, what the hell's going on here? You did a complete 180. Then, a few hours later, he comes out and says, kind of tries to split the baby. To me, this has been panic stoked by politics, and medical policy should be medical policy, and politicians should not be playing doctor. And what we're seeing right now is an election season where 1 week from now people are going to go vote, and from my vantage point here, that's playing into what they're telling the people they should or shouldn't be worried about, closing sub shops and bowling alleys and all the rest, when they should know better. Am I wrong?
No, you're not wrong. It's not surprising. It's called the election in 1 week. Remember what's going on, Richard, in the back of Governor Cuomo's mind. He criticized Governor Pataki years ago when 9/11 happened, when Governor Cuomo said all Pataki did was carry Rudy Giuliani's coat. What you're seeing here is the governor's personality and style. And his style is, I'm the number one guy. I say what's going to happen. And that's why you've seen the mayor brushed aside. That doesn't make it right. And what we're looking at is a panic almost in terms of the doctors should be deciding and the professionals what's going on. But it's called an election 1 week from now.
But that September-October crisis management only works if you do it well.
Yeah.
I mean, think back to Rudy Giuliani after 9/11. He did it well.
This is very
or
true.
go to Governor Christie or President Obama after Sandy 2 years ago.
And by the way, to your
Done
point,
well.
Mayor Giuliani, and I was extremely critical of him, and I know I'm not alone at this table, but he was masterful after 9/11 because he preached calm. He gave reassurance to the public. He told us we didn't have to live in fear. Look at what Governor Cuomo did. I got to tell you, Mayor de Blasio was a heck of a lot more statesman-like here than Governor Cuomo. He was consistent. He told people the facts of the medicine. He wasn't opining. He told us what we shouldn't do. He talked about how people were or were not contagious and what symptoms had to show at the time. And he commended the bravery of that doctor here who went there and came back and all the rest. And I get all this flip-flop. I mean, I'll get to Christie in a second. To me, that was patented.
The Governor Cuomo that we saw the first day of this year, I think it was Thursday.
Yep,
was
Thursday
fine.
night.
Was fine. That was fine. He gave the facts. He assured calm, and then after that, he just wallowed in the wind, depending on what he thought would help him politically. And that doesn't do anybody any good. And I keep thinking back to the debate about Obamacare, when everybody's saying, I don't want some politician making my medical decisions for me. And then he and Chris Christie have done exactly that and stepped into an arena where they know nothing. And they would have been much better off bringing in experts and having the experts give the information, as opposed to going out on a limb and then flip-flopping one way or another. And the trying to have his cake and eat it too, with the whole, I never changed my position, it's totally consistent. No, it's not. It's a complete flip-flop, and it's incredibly obvious, and it doesn't suit him particularly well 1 week from an election.
And then it gets down to Nurse Hickok. Here's a woman who goes over there, right? Comes back. We stick her in a tent when she comes back into Newark. Are we kidding each other? This is our neck of the woods. This is our backyard here. And this is what we do to this person. And then we treat her like a ping pong about whether or not she needs to stay in her house or not. We almost condemn her like, in some way she did something wrong. She's doing the very same thing we want to do. Now, I don't want to let facts get in the way of a good story, but everybody that has a conscience and a pulse and just a scintilla of logic says you can't put a big bubble around the United States and pretend that Ebola will go away and it won't impact us, okay? If you ask everyone, we ask people to go over there, but then they're not sure that they can actually come back to their home country, they're going to lie about their exposure to Ebola. People are going to find alternate routes to come back into the United States. It's not practical, and we do have to combat it over there before it comes here. That's a fact. But every messenger that comes out of this, all the partisanship and all the other baloney that's going on, it leads you to believe that I knew we were in a partisan politics. I do this every night with you two guys. But now it gets to basic medicine? I mean, how bad is that?
It's basic pandering. It's not basic
so
medicine.
bad.
It's basic pandering. And Chris Christie had the gall to say that he was doing this to protect the people of New Jersey. Does anybody actually think he would have come to that same conclusion if he wasn't running for president in 2016? To be able to take a tough stance against a scary thing that has a lot of people talking, a lot of people worrying. Now he's a headline. Look at the tough stance that the governor of New Jersey takes, quarantining this woman for everybody's protection. It's asinine.
And then he gets labeled as the panda bear, whatever, by Rush Limbaugh that he's capitulating. People don't even know what to believe anymore. Wait, somebody said to me this morning, wait a minute, Rush is mad at Christie. He must have said no more quarantining. I'm like, no, it's just Rush is a lunatic. So people don't even know who's giving in to what side anymore. We have confused the American public on something that is not an epidemic in the United States.
Well, it depends on, I know based on the numbers, it's not an epidemic.
What other thing are you going to use? It's math.
But, as I've said from day one of this, I don't think the medical officials know exactly what they're talking about.
Dominic.
I really don't. Richard, I'm sorry. And I think the evidence is on my side.
Wait, time out. I'll let you go. Give me the math that says that this has been communicated and spread to people in America other than healthcare workers. Give me the regular American right now that has contracted Ebola from somebody that was over there in West Africa that treated a patient that came here. Give me the person.
Okay, there may not be one person. wait, hold on. But all it takes is one. Wait, hold on, Richard. Okay, I ride the subway every day in New York City, as you do from time to time.
You're not going to get it.
Okay, well, yeah, but you don't know for sure.
Yes, I do.
No, I'm sorry.
You know they said the same thing about AIDS, right? Remember?
Yeah, I remember
when
that
Magic Boy, you come near him or whatever? I must have missed that. You have to have bodily contact, bodily fluids that have it exposed when they are fully showing symptoms. I'm not a doctor. I'm not playing one on TV. That's fact.
Can I jump in on this? Sierra Leone and Nigeria had Ebola outbreaks. The World Health Organization now says that they've been contained in Sierra Leone and in Nigeria. Do you think that the United States has a better health system than Sierra Leone does and that Nigeria does? So if they can contain it there, what makes you think they can't contain it here?
But gentlemen, you have a doctor that obtained Ebola,
Yes.
was riding around on the train, was bowling and doing all of these activities. People are scared. I understand what you say, what the scientists say.
And that fear,
people are scared.
That fear is what's stoking all of this political maneuvering that we're seeing
what's
from Cuomo
what's
and
also
from
stoking the
Christie.
political maneuvering is a weak president in the White House. Let's be honest about this. Christie and Cuomo are doing this because they have very little respect for the man in the White House. So they're stepping all over him.
I'll tell you what the biggest fear for me, or maybe this is a confirmation of, we are not healthy as a country. I know we're going to get into poll numbers a little bit later in the program, when it is not only convenient, but now taken as popular fact that the government can't do anything. First of all, it's not true. But also the biggest phonies and hypocrites out there who condemn the government, want to squeeze the government, now look to the government to solve every problem around the globe at all times, okay? So, but leaving the hypocrisy aside, if you have no confidence in things like the CDC here, or I can name the government agency to do the basic things to protect Americans, even though the facts say they do, many people like Dominic now says, we don't know what to believe anymore, and that is the most frightening consequence out of all of this, and that's into the void where the Christies of the world, and even the Governor Cuomo's, will play into, especially when the political calendar suits them. I'm off my high horse. Okay, now tomorrow is an anniversary of sorts, and not one that folks in our region need reminding of. 2 years since Superstorm Sandy, and residents around the region were beaten down by this. And the region, in many places, still trying to pick up the pieces. Delays in funding have many still waiting to get their homes and lives back to normal. We're going to get into a checkup as to how we're doing, and also we'll ask whether we, the people here, are willing to dig deeper into our pockets, paying more in taxes even if need be, to build the infrastructure to protect us from the next storm that is coming.